It's a brisk early fall morning in a farmer's field not far from Rochester, and the old people from the city are coming to pick potatoes. The gleaners, as they are called, take what is left over after the farm machinery has come through. Most of the gleaners are poor. Many enjoy the outing, but some of them are there because without the potatoes they pick today, they might not have enough to eat.
I come out here to pick up potatoes, but I didn't know, it was scrapping them. I have arthritis and I can't walk them down these long rows. All I was going to do just pick up on the ends, what it was, I wouldn't have to walk so far. I go down these roads, somebody had to come down and get me because I couldn't walk back. I need the potatoes, but I don't want to fall out.
Why do you need the potatoes?
I need them to eat because it'll stretch your budget. Living on a fixed income, you need everything you can get kind of free to help out because we don't get all that much.
How old are you?
I'm pretty eligible. I'm just about too old to be out here, but I'm out here.
Do you mind telling me how old you are?
Well, I might tell you, then I don't know whether I should or not, but I will. I'm in my 80s.
In 1985, one doesn't have to go to Appalachia or the Mississippi Delta to find hungry Americans. It's easy, too easy, to find them in Western New York. They can be found in the soup kitchens, where people go for a free meal and sometimes to sneak home with a little extra to get by. They can be found waiting for hours for a block of surplus butter or cheese. And they can be found in their own homes, waiting for a delivery from one of more than a dozen food pantries in Monroe County alone. There's even a food pantry in Fairport.
There is beginning to be a reemergence of hunger in America.
The Reverend Kenneth Dean, pastor of the First Baptist Church in Brighton, has studied hunger in America for nearly 20 years. He has served on 3 major commissions examining the problem.
We have found in 1984 what I term widespread food dependency. People have access to food, but the access that they have is through what I would call an arbitrary mechanism. They're never really sure whether they will have it tomorrow or not. I think that in 1984, as strange as it may seem, with all the advanced technology that we have a soup kitchen society.
It's the start of another day at St. Peter's Kitchen near downtown Rochester. The soup kitchen has been open for only 3 years, but the demand keeps on growing. Depending on the time of year, they may serve anywhere from 150 to 450 meals a day.
They say that the government takes care of people, but it takes care of people to a certain point, and when that runs out, people need to turn to somebody. It's not bums, or anything like that. It's people who come from all different backgrounds. I think families and, again, senior citizens, a lot of kids in the summer, lots and lots of kids.
They serve here good food, and everybody's nice. Everybody's nice to the little kids and the big grown-ups. And you don't have to pay.
What's happening here at St. Peter's is happening all over America. Business is booming at soup kitchens and at food pantries, where groceries are collected and distributed to the needy. Food pantries are served by food banks like this one in Rochester, much the way a wholesaler serves a retailer, only without the profit. The food is donated by churches and supermarkets. Second Harvest, a nationwide network of food banks, estimates that it distributed 15 million pounds of food in 1981. By 1983, that number had tripled. Locally, there are now 7 soup kitchens in Rochester. That's more than triple the number in 1981. The number of food pantries in the county also has increased, from only 2 in the late 1970s to more than a dozen today. Each of these cards represents one person who has sought help from just one of these pantries, the community cupboard on North Clinton Avenue, since 1981. Demand at another pantry is so great, they use a computer. 9 of the county pantries have reported the number of what they term food days they provided in 1983 and most of 1984. Food days combine the number of people helped with the length of time they are helped. In 1983, the 9 cupboards provided help equal to more than 96,000 food days. The number for 1984 is expected to be nearly 11% higher. What adds poignancy to the numbers is the fact that hunger is a problem that America almost solved. Kenneth Dean has been in on America's war against hunger from the beginning.
In 1967, in the spring of the year, at some hearings on unemployment in Mississippi, a lady stood up to speak about the problems of her family. And in being questioned, the senators who were questioning her were in something of a partisan debate. And they kept pushing her to try to get her to say that maybe her husband didn't want a job, or that her husband wasn't really around, or that her husband didn't care. When finally she blurted out and she said, "Senator, what I'm trying to tell you is that my children ain't got nothing to eat. My children are starving. It's my children I want to talk to you about."
The hearing prompted the late Robert F. Kennedy to ask Dean to do a study of hunger in Mississippi. That prompted the Field Foundation to send a team of doctors to study hunger all over America. The doctors found that hunger was widespread. They wrote,
"The children we saw were more than just malnourished. They were hungry, weak, apathetic. Their lives are being shortened. They are suffering from hunger and disease, and directly or indirectly, they are dying from them, which is exactly what starvation means."
The government responded by expanding the food stamp program tenfold, expanding the school lunch and school breakfast programs, setting up special food programs for the elderly, and the supplemental food program for women, infants, and children. In short, the government threw money at the problem, and it worked. 10 years after the first Field Foundation report, teams of doctors retraced their steps. In 1978, they wrote,
"There are far fewer grossly malnourished people in this country than there were 10 years ago. The government programs have made the difference."
In 1984, Kenneth Dean was part of a third commission, set up in cooperation with the Harvard University School of Public Health to study hunger in New England. The method was the same as the previous 2 commissions, and the results were depressing. According to this latest commission,
"Hunger has returned to America. We found concrete evidence of hunger in every state where we have looked. Elderly people living alone who eat only 1 meal a day. Sometimes they eat none. Parents who go without food for a day, sometimes 2 days, so their children can eat. Children whose school teachers say come to school hungry because they have had no food on the weekend. We have found that hunger is widespread and increasing."
We do go into homes where there's no food in the house, period. No food, no transportation, no money. One of the most disturbing things that I have seen happened in Mississippi in the Delta. In 1967, there were numerous shacks throughout the Delta, dotting every county and every community. These tar paper shacks were not really fit for habitation. When I went back in 1977, they were deserted. People had moved on. The farms had been mechanized. There was no need for these shacks. In 1984, I was stunned to find that blacks who had moved to urban areas, who had been employed for 10 or 15 years, were now unemployed, and they were moving back, and they had become squatters in these shacks again.
because hunger is a subjective feeling, it can be difficult to define and hard to measure. Partly as a result, a commission appointed by President Reagan concluded that it is impossible to estimate the extent of hunger in America. The New England Commission calls this contrived befuddlement. In addition to their first-hand observations, the Commission and other critics of current government policy say there are danger signs that can be measured. A Massachusetts Department of Public Health study found that more than 18% of children examined showed at least one sign of malnutrition. Nationwide, a steady 17-year decline in the infant mortality rate suddenly stopped in 1982. Since then, the rate has been virtually unchanged. In many poorer parts of the country, And even here in Monroe County, the rate has actually gone up. Locally, even the people who chaired Ronald Reagan's campaign are divided over the seriousness of the hunger problem, though not over what should and shouldn't be done about it.
I do believe it is a serious problem. Hunger's always been a serious problem.
Nationwide, I don't think that hunger is a serious problem. Both locally and on the national level, we are doing enough for the needy. There are those that work and there are those that receive assistance, and they both have rights. And I think that we have a good balance between those two areas right now. America, in general, we have a safety net with food stamps, AFDC, the other programs that people are taken care of by the government.
That safety net is full of holes.
Margaret Oberst is one of 11 Monroe County food pantry coordinators who meet 4 times a year to coordinate their efforts.
That they'll go on assistance because they can't make the whole thing come together with paying for daycare and going to work, and some might be receiving food stamps and it just doesn't cut it, so they have to do, go on full assistance, and that's not enough either.
I wrote to both the Democratic and Republican campaign chairmen in this county asking them, the candidates who are running, come on down sometime from 12 to 2 and see where the hunger is, and I've got no response.
When you're talking about these people, are we talking about able-bodied individuals, disabled people, or what?
I've got a client that she is disabled. She cannot walk upright. It's a very rare blood disease. She had her doctor go with her before the disability board with 85 bottles of medication, and they still cannot find out what's wrong with her. The disability board says, no, you're not disabled. You can work.
And sometimes we have ones on the senior basket recipients who are trying very hard not to get any aid, who are trying to live on Social Security only and staying in their own homes, and they really just don't have enough to eat at the end of the month.
Actually, you can say that they're a lifeline for me.
Alice Michelizio is one of these people. 2 years ago, an accident on the job left her too seriously injured to work. Unrelated abdominal surgery left her partially incontinent and unable to tolerate certain foods. Michelizio has lost workers' compensation benefits, a decision she is challenging. She also was initially denied Social Security disability payments. She appealed and won partial benefits, but they are not expected to start for another 4 months. In the meantime, she lives in this Rochester home on $259.40 a month from her late husband's pension benefits, $62 a month in food stamps, and a monthly delivery of food from the community cupboard.
I don't think that I would really be surviving the way I am. I need them. I depend on them. As I said, there are a lot of things that $62 a month doesn't cover.
When we saw Michelizio, she had one overriding fear. She had heard a false rumor that the community cupboard might close.
I had heard a rumor that they were not going to allow the food cupboard to continue because too many people feel that it's not helping and it's not a necessity. And I feel it is a necessity to the community. I feel that people in my situation and other people who possibly were employed and are laid off with families have no place to turn to but the food cupboard.
People like Alice Michelizio are finding some unexpected company at the food pantries.
A lot of times you think of only welfare people as needing help, but a lot of times too your higher income people, once they suddenly are unemployed, they do not have the resources to keep going.
Barbara Keene runs a food pantry located in Fairport. The pantry serves Fairport, Perrenton, and Pittsford, some of the most affluent communities in Monroe County.
We do go into Pittsford on some streets that you'd be very amazed that we're on, and same in Fairport. When I started in '82, when I took the job as a verifier, which is the person who receives the call, they told me we were getting 4 to 5 calls a month. And right now we have 3 verifiers fielding 45 calls a month.
One must be careful not to make too much of this. The Fairport Pantry serves one of those rarities, a low-income housing project in a suburb, in this case Perrenton. But the existence of the food pantry for Fairport lends credence to what people who run soup kitchens and food pantries all over the United States are saying. That a lot of people who condemned so-called welfare cheats yesterday are standing in food lines today. In some ways, the people on those lines in Rochester actually are lucky. The extensive network of food pantries and soup kitchens in Monroe County is widely viewed as sufficient to prevent people from going hungry, provided the people can be found and put in touch with the right agency at the right time. But Monroe County is exceptional. All over America, the people who run food pantries and soup kitchens say they can't fill the gap. And one doesn't have to travel too far from Rochester to find conditions that are even worse. This is Albion in Orleans County. And this is the line outside the offices of the Orleans County Community Action Program on the day they give out free butter and cheese. On this line can be found representatives of nearly all the groups left behind by the economic recovery. Single parents with small children, the elderly, the disabled, and in the county with the highest unemployment rate in the Rochester region, plenty of laid-off workers. Most of these people wouldn't tell their stories on camera. Gloria Kabik would.
There is no money to be had nowhere. No jobs, no nothing. And it is a sin to what's happened to this country, really.
Do you have enough food at the end of each month?
No, we scrape bottom. I do a lot of baking. I do a lot of canning out of our garden when it comes in, but this year the gardens haven't been good neither.
So how do you get by?
Pray to the Lord. That's how. A prayer to the Lord. And there's a lot of them that's worse than we are. I have seen kids go to bed without food in their bellies. I have lived next door to people that didn't have nothing, came up from West Virginia, and had little kids that didn't have nothing.
Elderly have been found stealing groceries.
Annette Finch is in charge of surplus food distribution in Orleans County.
It's frightening to have to see what our elderly are doing because their Social Security checks or their pension checks are not stretching through the month. Where they have to resort to going into a local grocery store and having to steal some bread or some meat or whatever to get them by. Going into a home one day, I did find an elderly lady sitting there eating the same cat food that her pet was eating.
Is there anything else in particular that you'd like to say?
Yes, please, Lord, send it all down for everybody to have a little something and go to bed with full bellies, even the kids.
Why has hunger returned to America? Why are we living in a soup kitchen society? On some points, there is agreement. For instance, just about everyone, from Kenneth Dean to Joanne Van Zandt, blames changes in the structure of the American family.
We now have families, both young and old, who are single-parent families. It used to be that families stuck together, if you will. Fathers were always around. Nowadays, there's more freedom, so you have women alone, women with children trying to raise the children.
There is less agreement about the impact of Reagan administration budget cuts on the resurgence of hunger. The food stamp program now spends $7 billion less than it would have had there been no federal cuts. Another $5.3 billion was cut from child nutrition programs. According to the New England Commission, quote,
hunger is the result of clear and conscious actions taken by government leaders.
The budget cuts, let's look at that. The reform in '81, what that did, it dealt with eligibility for, say, food stamps. And it used 130% of the poverty level as the eligibility thing. So the eligibility in budget cuts only dealt with the lower middle class. The safety net, the protection for the poor is still there, so it's not attributable to the budget cuts.
But according to the Congressional Budget Office, the cuts went further than that, affecting all food stamp recipients. According to the CBO,
the largest savings resulted from eliminating the inflation adjustment for benefit levels in 1982 and postponing certain later inflation adjustments.
Nevertheless, according to Harold McLean, head of the Northeast region of the U.S. Department of Agriculture's Food and Nutrition Service,
we go around and spend an allotment of food stamps in a grocery store. And I'm not suggesting that you can buy the best cuts of meat or the highest premium canned vegetables, but with some knowledge of shopping in the grocery store, you can get by.
Critics of federal cuts say this argument has several flaws. First, food stamp benefits are calculated to provide recipients with slightly less than 70% of what they would need to buy food, according to something called the Thrifty Food Plan. But the Department of Agriculture nutritionists who designed the Thrifty Food Plan said that it was only good for short-term emergency use. It was never designed to provide adequate nutrition over the long haul. Second, Agriculture Department studies show that the poor are actually smarter, more careful shoppers than average Americans. But unlike McLean shoppers, they are not professional nutritionists. In addition, the elderly in particular may not be able to get to the stores with the best bargains. So it's not surprising that the Agriculture Department also has found that 5 out of 6 people who spend at the Thrifty Food Plan level don't get the U.S. recommended daily allowances for basic nutrients. Third, food stamp benefits are based on the assumption that recipients can afford to spend 30% of their cash income on food. That assumption is based on data from the 1950s, when other costs of running a home, such as energy, were much lower than they are today.
The theory, as I understand it, behind the assistance levels, for instance, in food stamps, is that's not supposed to make it through the whole month. People are supposed to have 30% of their income to spend on food. How come it doesn't work?
Good well, I think Kay's point about the rents is one big factor, because nobody can pay the welfare allowance and rent.
The numbers bear out that impression. The monthly allowance a typical family on aid to families with dependent children gets to pay the rent falls anywhere from $66 to $152 short of the average rent for an apartment in Rochester. In addition, the food stamp cuts came on top of other cuts in federal programs. According to the Congressional Budget Office, between 1970 and 1983, AFDC benefits declined by more than 30% in real terms, adjusting for inflation. Thousands of disabled Americans were thrown off the Social Security disability rolls. Rents in federal low-income housing projects were raised from 25% of a tenant's income to 30%. Low-income energy assistance has been cut by $1 billion more than the total food stamp cuts. In addition, the length of time during which unemployment insurance can be collected has been made shorter, at a time when there are strong indications that many Americans are staying unemployed longer. For all that, the impact of the federal budget cuts could have been even more severe.
I'd like to welcome you all to the WIC program. You're going to see a short slide presentation explaining what our program is all about.
The Supplemental Food Program for Women, Infants, and Children, known as WIC, does what the name implies. It provides extra food for pregnant and nursing mothers, infants, and young children, provided they are both poor and found by a doctor to have special medical needs. The program provides nutrition counseling and requires regular medical checkups. The most pessimistic evaluation of WIC that we could find was in the report of Ronald Reagan's Hunger Commission. Even that report concluded that 4 out of 5 studies of WIC they examined showed that it had a demonstrable positive effect on pregnancy outcomes. Another study estimates that every WIC dollar saves $3 in later health care costs. In his first term, President Reagan repeatedly sought to eliminate the WIC program entirely. Congress has refused. In fact, WIC outlays have increased slightly, but not enough to keep up with inflation and increased demand.
For the first time, we have a waiting list of over 600 children who last year at this time would have been eligible. But this year they're not high risk enough.
According to administration critics, what it all boils down to is this: the combination of recession, societal change, and cutbacks in all social programs left millions of Americans forced to the very edge of a cliff. Instead of pulling them back from the brink, administration food policy has been the extra small shove that forces many of these people over the edge.
If what you are saying is correct, obviously then they're being pushed over into the poverty level. And I was somewhat surprised to find that under the government figures, there are 35 million people who definitionally are in poverty. But people are not starving to death. They're getting enough assistance, and it's my understanding that nutritionally, despite the reports that you have, they're being taken care of sufficiently. It's not a problem if they're being taken care of. They're going to get help, and if they're being helped, that's the purpose of the programs. So I don't see that as a problem.
The President's Commission holds a similar view. As long as people can get by somehow, by finding a food pantry this week and a soup kitchen the next, then there isn't really a problem. And as we've seen, Monroe County is one of the few places in the United States where that probably can be done. But at what cost? As Kenneth Dean and others point out, a soup kitchen society in which thousands of people live from hand to mouth, standing for hours in the cold, never knowing where their next meal is coming from, is a system that, at best, feeds the body and starves the soul. Dean says it is bound to worsen the very societal and family problems that everyone says helped to cause the hunger problem in the first place.
These families were breaking up, and everywhere we went, we met mothers whose dreams had been crushed, who were left eating out of soup kitchens and food pantries. The young husband frustrated and floating in unemployment.
Good morning. Praise the Lord. It's good to have you this morning in our Thanksgiving service. We welcome you and we greet you in the name of the Lord.
Thanksgiving Day at the Open Door Mission in Rochester. The mission has been here for 32 years.
Well, when I first came here, we served 7,000 meals. Last year, we served 44,000 meals. Originally, we were strictly a street alcohol mission, and in the years that I've been here, it's changed the makeup of our people, and our folks come from all walks of life.
I'm not so sure we ever will really cure and have a society where there are no people who are hungry. It's something that we just have to keep working at. And I think if you expect that in so many years, if we keep pouring enough money into these programs, that we will find everybody totally satisfied, I just don't think it's a reality that can take place. Would that it could, but in a country this size, we would soon run out of funds to put into those programs.
Even if the economy prospers, even if cuts in government programs are restored or even expanded, some people always will slip through the cracks, and they will need places like the Open Door Mission. That, it would seem, is inevitable. But the kind of hunger Van Zandt is talking about, the kind we have in America today, is not inevitable. We know that because less than a decade ago, we came very, very close to wiping out that kind of hunger, and we did it without running out of funds. There is nothing inevitable about a soup kitchen society. There is nothing inevitable about a system that requires thousands to stand for hours waiting for a handout. There is nothing inevitable about a system that requires families to search, sometimes desperately, for a place that will feed their children. There is nothing inevitable about a system that denies special help to 600 children at nutritional risk in this county alone. There is nothing inevitable about a system that allows infant mortality to increase in a county as prosperous as Monroe. And there is nothing inevitable about a system that requires old women to pick potatoes in order to stretch their budgets. For the 21 Report, I'm Richard Wexler. Good night.
What about traffic bushes?